This year alone, nearly 2,000 people in Colorado will be diagnosed with colorectal cancer.
It is the third most commonly diagnosed cancer in the U.S., falling from the #2 spot, though, thanks in part to routine screenings. And joining us today is Dr. Ken Blake from Skyridge Medical Center. Thank you so much for being here.
Thank you for having me.
So we see those numbers coming down that show the importance of screening. How does that show the importance of screening?
I think it shows the importance of screening. This is not a disease we talk about a lot because it is unsavory to talk about at the dinner table. But 1 in 18 Americans will suffer from colon cancer at some point in their lifetime. If you have family history, your risk roughly doubles to 1 in 9.
Wow.
Often there are very few symptoms. There can be symptoms, but commonly we find tumors on screening examinations. And screening is also important because if we find polyps, we can remove those, and that can reduce the risk of colon cancer.
What is it that makes this type of cancer so common? Is it a lifestyle choice? You mentioned genetics.
So the genetics is probably the most predisposing factor. So if you have a first-degree relative, mom, dad, brother, sister, your risk has roughly doubled, as I just said. There are also probably dietary and environmental contributing factors that we don't completely understand.
Right.
So at what age should we start getting those screenings, and how often should we get them?
So if you do not have a family history, the age is 50.
Okay.
If you have a family history, you should start screening colonoscopies at age 40. And you're asking about screening, but we are seeing a downshifting of the age. More and more younger patients in their 20s and 30s we're finding with colorectal cancer.
Wow.
So I think it's important for your audience to know if they're below 40 and they're having symptoms such as rectal bleeding, abdominal pain, a change in the bowel habit, a loss of energy, unexplained anemia, weight loss, or anything else, they should speak at least with their primary care provider or seek consultation with a gastroenterologist, a colorectal surgeon. That would be helpful.
And when you see those symptoms, and if you go get checked out, is it still treatable, I assume, at that point?
Yeah, the majority of our colorectal cancers are treatable. The treatment consists of combinations of surgery, chemotherapy, and radiation. But the majority of patients can be treated, and indeed the majority of patients can be cured.
And I'm sure just like everything else, you want to catch this early.
Yeah, correct.
Earlier the better.
All right. Thank you so much for joining us. Some good information today.
Thank you for having me.
And we have a lot more information about colorectal cancer and the warning signs, as well as links to resources like the American Cancer Society and Sarah Canyon Cancer Institute, available on the Your Health Matters page of thedenverchannel.com.